prior to my participating at LA Care and MLK, I was in the dot-com world, and I was with startups of my own making, as well as those that I joined, many of them that failed horribly, a few that were decent, and one where I had a pretty decent exit and great experience. But in one of those startups, I was with the team, and all we did was AI. And we were programming AI back in 98, 99. I was telling my friend Anthony from Chalk here that, my school of thought of AI, and you haven't heard it yet, but I think it will come back, is a school of AI called fuzzy logic. So we did a lot of programming in fuzzy logic. We did neural net programming as well. Back in the day, back before there was cloud computing, back before there was the iPhone, which is, came out in 2007, back before there were apps. How many of you remember the Palm Pilot? I think the Palm, yeah. Oh, yeah. Oh, we got some addicts here. Nice. Yes, I was a Palm Pilot person. So yeah, I really want to thank you for the opportunity you've given me, and what I plan to share with you is what I think about the applications of AI in healthcare. So my soapbox is that, and I know this is a continuing education thing, so there is some information there. I think the slides are being made available, but most of my slides are for just for shock value, more than anything, and entertainment value, hopefully. So let me begin by saying that I think it's impossible right now to talk about the future in healthcare without hearing or seeing two pixelated vowels, A and I. Together, they represent both a hope and the fears in our industry. I think the impact that it will make is tremendous. Some will say extremely positive, and some, like many of our physician colleagues, will say cautiously so, not so positive. And I think that's a responsibility we all have to take in this wild west of healthcare, of innovation in healthcare, and especially where it pertains to AI. And I'm just blown away by the amount of deal flow. You guys know what deal flow is? Startup companies that are coming up in healthcare, which is great to see that innovation. But many of them have some form of AI that they are that they've installed, that they're implementing, that they're promoting, or that's part of their delivery. So it's quite amazing. I always have, every one of my presentations goes back to this slide. This was a little bit of history from my LA Care and especially my MLK days. I'm blessed, so I have the opportunity to say that whatever I do and hopefully whatever you do, we do it for the fact that we're trying to ultimately take care of our friends and family, the patients, the members in our health plan, whoever those are. And I think it's important to note that there are many that don't have equal access to care. And it is shocking, in light of all the innovation that is coming, that has come, that is coming now. My goal, and this is the only time I'll mention WISE Healthcare, is to deploy those solutions, innovations, disruptions in the safety net first for those populations that don't have it. I think that's a moral responsibility for us. So innovation's a big word. We've been hearing it. It was the buzzword, what, 4, 5, 6, 7 years ago in healthcare. Everything was innovation. And I believe that there is no better time than right now, than tomorrow, than yesterday. In fact, I feel like I'm 2-3 years behind schedule myself in getting stuff done because it is a fast-moving thing. There is a pitch competition here on campus at UCI. 60 companies, more than half in life sciences, pitching their solutions right now in front of judges today to get ahead, to get funding, to move forward. So innovation is alive, but I think in healthcare is one of the last few industries that is now opened up to disruption and innovation. And of course, AI plays a big role. One of the things that was mentioned by Mary Beth in my background is I had a hand with a really smart team of people to implement e-consult, telehealth solutions, what I call now virtual care. And there's a little bit of an analogy I want to draw between artificial intelligence and telehealth. Oops, sorry. And telehealth. And that is, both of them were created as a study and as a tool in around 1950, 1956. Some dates move, but in the 1950s is when the first fax machine came out as well, just a quick note. And telehealth also came into, and actually telehealth goes a little bit further back in World War I and II. The first radio-based diagnosis and treatment in the battlefield happened, and they called that telehealth, and it was burgeoning. But both also share a unique thing. For many years, people proponed telehealth as this separate study, separate application. They've been trying to make it happen. And it's been around for a long, long time, but people still think of it as a new and separate thing. They're trying to reimburse it in a separate way. My concern is that AI has been around for that long as well, and now it's coming as a resurgence. And hopefully it doesn't get put into a separate category of a new tool, a separate delivery mechanism that needs to be reimbursed and be regulated like telehealth is. So that is my caution there to you. And like telehealth, AI and telehealth are both really coming into the forefront because we have cloud computing, we have technology, faster processors, and processors is a key word. Faster and also ubiquitous access to mobile device. All of you in this room, guaranteed, and if I'm wrong, raise your hand, have a smartphone on you, right? A device that's more powerful than a computer 10 years ago, or 5 years ago even. That processing power in your pocket, which costs $800, but you pay $30 to somebody a month to lease it, that's a computer in your pocket. That is now ubiquitous, not just for us that are privileged in this room to be here in the US, to be in Irvine, to have technology, houses, et cetera, but it's around the world. People have access to these tools, and that's gonna play a very important role. The challenges in healthcare are numerous, so I'm not gonna enumerate them, but some of the key things that I think that's come up where AI has great application is something that was sponsored by actually President Bush before he left, Bush Jr., and then signed into law by President Barack Obama, and that's the 2009 American Reinvestment and Recovery Act. And within that act, there were two pieces of legislation that made up the High-Tech Act, most of which funded, across the board, electronic health record adoption. So what's occurred after 6-7 years of electronic health record adoption? Data, tons of data. That many startups, many companies, IBM Watson, not being a startup, but everybody's getting in to figure out now what do we do with this data. The words initially were big data. We're going to tackle this with big data and predictive analytics, but now AI is in our zeitgeist. AI with machine learning, deep learning, whatever learning, algorithmic learning, they're coming to the forefront because now there's data to train these AI systems on and to capitalize on that data. And I think there's a transformation that's going to come, hopefully, to the electronic health record itself, because I think one of the greatest things we've done is implement EHRs, but it's also one of the not well done things. I think EHRs have hampered delivery of care in many ways, have challenged and tired the providers, both physicians and nurses, because ultimately it was based on a billing system, revenue capture system, and it has so many challenges. And layered on top of that were all these quality metrics that was thrown in to report on, to click buttons on. And I think we're still dealing with that challenge. So there's a lesson there that we want to prepare for and avoid in implementing AI. We don't want AI to be that tool that's used that takes away from humans, but adds and supports the human thinking process, the human process of delivering care. So there are numerous challenges from prescription drugs, providing accurate diagnosis, health and wellness alerts to individuals, processing the mundane tasks. I've seen a couple of companies, one where an AI will pre-populate a hospitalist note, saving 20 minutes per record of time of note-taking, where the hospitalist can just review. Great ideas that are coming to the forefront. So I've mentioned fitness and wellness, diagnosis, decision, treatment, and condition. That's great. And this is actually a stepwise fashion towards really utilizing health information technology. The missing element is AI. Now, IBM Watson. You guys have all heard about IBM Watson, right? You guys know it. I don't have to explain it. They are tackling cancer and diagnosis in many parts of the healthcare delivery because IBM Watson is really good at crunching structured data, electronic health record data, and providing a probabilistic outcome of there's this chance and this chance of cancer here, likelihood here. So IBM Watson is probably the first, and I bring them up because they did something very smart. They popularized artificial intelligence by putting it on Jeopardy. Everyone loves contestants on Jeopardy. You know, we're always rooting for that underdog and or the really smart guy from Utah that won $1 bajillion because, you know, we want to be like smart people. We want to guess those answers or have those answers, say, yeah, I answered the same question. And then you have IBM Watson come in that was just doing it like this, so fast. Access to the internet speeds, all of that is now combining to provide tools and technologies that will disrupt healthcare. And IBM Watson was just the intro. I mentioned cloud computing. I've mentioned I think ubiquitous access to internet, even though in the US it's not as broad and wide and as high speed as in many developed and in even developing countries. But I think that's a big component. Again, I go back to the words of Martin Luther King, to make all this available, to make these tools available, artificial intelligence being the one that's, I think, going to disrupt the most. We need to make sure everyone has access to these tools, access to the internet. So I always bring up AI now because I can talk about it. This is, for me, this is a freedom. In 1999, 2000, my team and I, we had developed a great AI tool, and we sold it as an AI tool. We went to hospitals, health plans, providers, specialists, nurses, everywhere you could go, and the same response we got. It was like, what is AI? Oh, we're afraid of AI, because their thought was Terminator or Dave. And so we kind of recoiled a bit and said, we can't call this AI. This is 1999, 2000, 2001. We're going to call it decision support, because it's not going to replace the doctor. It's not going to replace the doctor. And let me repeat that. It's not going to replace the doctor. For those of you, for educational purposes, the types of AI, you can Google it. You can research it. A good friend of mine wrote a great article summarizing AI. But I bring this up because there's machine learning, there's deep learning, there's algorithmic approaches to AI. The quintessential description of the application of AI 30, 40, 50 years ago, and this graphic looks that old. I think that's when those graphics from Microsoft 3.1 came out and people made this. This is basically a description of, there's a knowledge engineer, there's some knowledge captured, because back then there wasn't a lot of data to pull from. An inference engine was put in, that's the AI engine, and then of course a user would use it. So this is your basic AI, not 101, but AI 1. But is artificial intelligence a solution for healthcare? It's a loaded question. The answer is yes. You have heard the stories, and I'm going to share a few of them with you here to highlight. But I know that you have done your own research. I know you've looked on Google, you've researched DeepMind, and many other things. Let me highlight prescription drugs and the application of AI there. Anywhere there's a lot of data, anywhere there's a matching that has to occur between a patient and the drug, can a tool, an artificial intelligence software-based tool, do it better, faster, more accurately? Yes. Again, it depends on what is fed, the data. But in prescription drug, there are many other applications. One is human trials. There's a company that I was fortunate to do some due diligence on. They were part of the Cedars Techstars Innovation Center. They actually had a deep learning tool that crunched structured and unstructured data. They were hired by the CIA to go through all of the intelligence data to look for those specific things that CIA looks for, those threats. They had beaten out IBM Watson. And this was a startup company of four individuals. And they were making money. They didn't even raise money, but they said, hey, we want to really scale this. So they got into Cedars Techstars, and overnight, they dropped all their government business, literally overnight. It seemed like, I was like, why are you dropping your business? There's money coming in. They said, no, we're going all healthcare. And Cedars opened up a window for them. They said, you know what? A few years back, we have Epic, and it's awesome, and we have all this data, and a pharmaceutical company came to us, and we're on a list of all these pharmaceutical companies that say, hey, do you have this type of patient that we can enroll in our human trial, FDA human trial? And Cedar said, yeah, we do. They wanted 500 diabetics of a certain level of criteria, et cetera, et cetera. I'm sorry, 800. And they pulled the data from the EHR. The humans pulled the data from the EHR. And what ended up happening was when it came time to enroll those folks, they found out that less than 300 of those 800 actually did qualify, even though they're all diabetic. Something was missed. The human interpretation, the data, the poll. It was very bad for Cedars because pharmaceutical companies are on a very tight timeline to do what? Get their drugs. The moment they invent it, there's a patent period. They have to get their drugs to market fast before it goes generic. So they are focused, and millions, if not billions of dollars are spent to get through the FDA process. So here comes a very small company that has this AI tool that can crunch data, structured and unstructured data, because some of that EHR data is still unstructured. They put it into play. They found out that their tool could find more accurately and much faster those patients that are needed for human trial. Business opportunity, business model there. What's the benefit to the patient? Those patients that need that care, need that critical care that's not available now, they can at least have a chance, an opportunity to participate in human trials and applications of that drug. Billions and billions of dollars, this company, I think, will skyrocket, and is an example of startups that were in another field coming into healthcare and providing their applications. But again, the hope and the fear, and here's the fear. I think we all have embraced AI. The companies that are in healthcare have embraced AI. In fact, many of them bought URLs, IBM.ai or whatever.ai. I tried to get Sajid Ahmed.ai, didn't work. I tried, actually. I thought, let me get my name, AI. But I think it goes back to this Hollywood-based fear of what will AI do? Because AI has been bad, right? AI has had a negative connotation in the industry. But I think that's also one of the challenges that exists for these startup companies. Things improve, though. Star Trek fans? Any Star Trek? Don't be shy. Don't be shy. Really? How many? Wait, raise your hand. Okay, yeah. Okay, good. A few more raise their hands with confidence. This is the emergency medical assistant on the Star Trek show called Voyager in the late 90s, early 2000s. And it was a holographic, AI, fully interactive, diagnostic agent, a thing of the future. Well, they also had in Star Trek the tricorder. There's been a tricorder competition that's been won successfully. The tools and technologies are here. Recently, Baymax, any animation comic book fans? Anybody with kids that saw Baymax? Come on, you guys are killing me. So this is, again, the trend is changing in Hollywood, which is good. This is Baymax from Big Hero 6, who said, hey, it was an emergency medical inflatable AI. It did more than that, but it was able to diagnose. And if you look on the screen, I just love this. Took me a while to catch it. Symptoms, diagnosis, it was doing it all. And interacting with the boy or the patient, whatever, but it's been changing. So IBM Watson, I went over DeepMind. So there are tools out there. Microsoft has it. Google has it. Apple actually is now committing to building a whole suite of AI chipsets. So everyone is getting involved. DeepMind Health, the key word here that I took this to bring this out to highlight, what's below? Clinician-led technology. Because they learned, what I learned and what many of us learned in those early days, that if you bring AI and say, hey, this tool can do better diagnosis, can find those nascent breast tumor potentials in a radiological image faster and better than you, can find those things in an MRI faster and better than you. It creates fear. It will really disrupt the workforce in many areas of healthcare delivery that involve the human eye expert, the human diagnosis. I think they're very smart to say this is clinician-led technology so that they can get in. And that was a mistake we made. So I mentioned a number of startup companies. This is CB Insights. I highlight CB Insights because they do a lot of research. Through my VC companies that I do due diligence for, there's some of these that I've seen. There's even more. This is actually a year old, because so let me add a few more. This is now broken down of all these companies that are involved that use AI in some form in these various areas, from virtual assistants, which I think is going to be big, and I think the Siris, the Alexas, the Cortanas of the world will eventually incorporate and are already incorporating diagnostic consumer-based technologies to answer the question, what's wrong with me? What's wrong with my child? I see this rash, or there's a concern. Do I need to go to the ER? What do I do? Because we're still challenged in our healthcare system of what to do. Here's an example of the trends of the deal flows that are increasing. From 2011, not so many, and these are the types of industries where the deal flows have had. You could see that healthcare has just skyrocketed. The amount of startup companies and companies investing in startup companies, buying up startup companies, creating their own startup ventures in healthcare technology, and healthcare technology using AI is increasing. So the reason I highlight this is it is inescapable that over the next 5 years, inescapable, that you will see many of these companies will fail. A number of them will get subsumed under bigger companies. A few, maybe a Facebook or an Amazon-like, will come out and do something. But I think those Amazons and the Facebooks, they're already working on this stuff because they have access to the most important commodity, and that is all of us. They have access to us. I can buy almost anything I want on my Amazon app. That is scary, and it gets here either the same day or tomorrow. That is crazy. But imagine healthcare being delivered to you like that. I have a chief complaint. I don't know what's wrong with me. My children have a pain here, or they're not feeling well. Can I take a picture? So right now, I have really good friends in various medical areas, but in derm specifically, my daughter got a rash. It looked terrible, and we were traveling, and I was like, I took a picture and I sent it to my friend Dr. Noah Kraft, and he responded very instantly. It's a good friend, and said, "Oh no, it's just this, this, and this." But I'm lucky and we're lucky for those of us in the healthcare field that have access to our friends that are physicians that we trust and rely on. But now AI tools are coming, and will be in your hands in the next 12 months, in the next 24 months. Again, artificial intelligence startups, skyrocketing. This is available. You could go through all these companies. They're doing something in some form, in whatever. And again, my little soapbox is, one of the areas that I think that is untapped is that physician-patient interaction, that initial diagnosis. Way back when, we knew it as a decision tree that was used by like WebMD, Adam, and a few other tools that guided us, that emulated those books from way back when that we had, that our moms and parents had, that looked up a symptom and then followed a decision tree and said, oh, it could be this. Those are being made smarter. And in fact, let me pause here. How many of you have what they now call a smart speaker, an Alexa, an Echo at home? How many of you? Come on, raise your hands high. Don't be shy. It's not a bad thing. How many of you just ask it for weather, time, and basic stuff? I still do for some reason. Our relationship is growing. My son uses it now to test his homework. He does the math on it just to validate. So instead of going onto a calculator, he's just doing the voice, quick and easy. We're now looking at movie times. We're now asking Alexa to tell us a joke. stuff like that. We get the little updates. But how close are we to just wanting to say, oh, I've got this pain in my knee, Alexa. I don't know what's wrong. And then Alexa just starts talking to you. It's happening. It will happen, and it will happen sooner than you think. The AI market by 2025, I copied and pasted this, $23.4 billion. This is from an article in March from Research and Markets. A $30 million investment to GraphCore. The investments in companies, small companies, reminds me of the crazy days of 1995, 96, 97, 98, the dot-com era, where if you had 10 pages of a decent business plan, you could get somebody to throw you $1 million, $10 million. It was crazy. You had people hopping from one startup to another within 2 to 3 months. It almost feels like that right now. That's how much deal flow there is. In fact, a year ago, I presented on this. I had a fortune to present on this. My initial research showed there were 131 startups. I looked it up. I didn't get a chance to update this, but it's gone over to 300 startups in healthcare with AI alone. So it is a fast-growing thing. So disruption. Dermatologists, equally effective at identifying skin cancer. AI dermatologists. AI and dermatologists. Mark Zuckerberg, Zuckerberg and Elon Musk, they have a philosophy. They're fighting each other. But AI for disease prevention, huge application. IBM Watson diagnosing cancers, not only in South Korea, but now in many other countries. Their deal flows, they're very expensive, but the advantage to health systems that can reduce costs, provide better care is huge with Watson. It's booming. This is a little bit old. We know it's booming. An AI that knows that you're sick before you do is really that combination of another 3-letter word, IoT, the Internet of Technology, things, the wearables we wear connected with AI tools will tell us what's happening to us, how it's happening to us, and maybe provide prevention before we discover something acute, and even tell us you need to take care of it. So the doctor will see you now. I want to repeat, this is not replacing a doctor. In fact, I think this has benefits in areas where there's shortage of doctors. It can help provide support to the NPs, the nurse practitioners, the primary care physicians, or the physician's assistants in areas that don't have access or don't have doctors per se, in areas that have limited specialties. So I think AI is a great opportunity, a tool, not a replacement. And it's hard. An example I always give is when the ATM came out. How many are oldish enough to know when the first ATM came out? A few of you. Now, when it came out, they sold it like, with an ATM, you will never have to go inside a bank. Has that ever been true? No. Because an ATM can do a lot of things. Heck, my phone now, I can deposit checks by taking a picture of it. It feels weird to me because I still have the check. What do I do with the check? I took a picture of it. It says the money's in the bank. But anyway, my point is, even for me as a technologist, if I ever got, like, from my college days of working, if I got, or high school, I got paid whatever cash, I did everything with the ATM, but I would always go inside a bank and hand my cash to a person. It's a weird little idiosyncrasy. To this day, I still have it. I got all this cash from my kid's piggy bank because he wants some money, and I took it from him. But I'm going to go inside. And so I don't believe in that analogy that we're going to lose all the jobs in healthcare. In fact, we have shortages in many areas of qualified people that are not working to what many say, to the top of their license. So yes, there will be AI doctors that we interface with because of one single word: convenience. Convenience and confidence. Why do I order my stuff on Amazon? Convenience. And I think that's the real disruption. So AI, just to kind of finish my thoughts here. Many people have equated AI, and I'm one of those people, with an industrial revolution. I absolutely believe, and I think if you don't believe me, that's fine. Do the research. Be aware that AI, those 2 syllables, artificial intelligence, and in its various forms and applications, will disrupt healthcare at all levels, financially, in the revenue cycle, capture, billing, cost management. It will affect medical records, hopefully for the better. There'll be tools that will make EHRs actually bearable for those providers that need to use it in their cultures, in their scenarios. And of course, I believe that AI has a great potential to the most important aspect of our lives, which is the personal convenience of getting something that we don't know sometimes what we have. We ask our doctor friends if we have them, our nurse friends if we have them. We, for many years, for the last 10 plus years, how many of you have at least once, if not more than once, looked up a condition or a symptom on Dr. Google, the Google bar, right? We all have, for our friends, for ourselves. So I think that's where a major disruption is coming in a very big competition and fight. So we've had an industrial revolution. We've had the communications revolution. We've had the information age revolution. The last revolution, and of course, this is my, by the way, this is my Commodore 64. That's how old I am. I started programming on a Commodore 64, so I changed. I was not an XT fan, so I'm sharing a little bit of history. But ever since computers were invented, and ever in 1956 and on, AI was one of those tools. It was an academic study. It was one of those tools that saw applications in the medical and healthcare field. PubMycin, eMycin, a few nascent applications were created in AI going back as early as 1959, 1961, and now it's come full circle. The technologies are in place. Everyone has a computer in their pocket, if not on their wrist. The disruption is here. The question is, and of course, we've had the internet. Where do we go from here? Healthcare is one of the hardest industries to move in any direction, and positive. I think medical technology has been great. The last 30 years, pharmaceutical, biomedical have been great. New tools, new technologies. But health information technology really didn't hit its stride until just 6 years ago, 7 years ago. In fact, everyone called it e-health when the internet came out, but now it's health IT. And telehealth was just this remote thing that, no pun intended, used by rural communities in Alaska or rural communities in the Midwest. Telehealth is for anybody, everybody, right now in urban settings or rural settings. And the tools and technologies are almost free to use. You can use your Skype, you can use FaceTime. It doesn't matter. The modalities of accessing that don't matter. And now you have AI. But I think if you have to take anything away, do the research, educate. I don't know how many are from provider settings or healthcare settings or whatever. If you're an entrepreneur here, do your research on healthcare. If you're in healthcare, do your research on AI. Because healthcare is a very challenging industry. It is, I think, the best time now. It is more accepting of change. Electronic health records have kind of pushed health information technology, the management information, the management of those tools and devices in managing populations and patients rely on technology. So artificial intelligence, that is the next step. It's already here. We're already behind the curve in getting involved in artificial intelligence, is my belief. It will redesign healthcare delivery. The biggest, and I don't have the graphic, but it's a great visual. You guys all know about Amazon, Berkshire Hathaway, getting in and saying, for all of our employees, we're going to provide our own health insurance and healthcare ecosystem. To think that they're not going to deploy technologies as part of that full ecosystem, from a person at their desk working at Amazon or in the warehouse or wherever in the Berkshire Hathaway of companies that they are involved in, to say, hey, you've got a tool, use this to diagnose yourself, talk to Alexa, then have an appropriately scheduled appointment. That's coming. They will do it, they will try it there, and then they will disrupt. And on that day, I think you guys, for those of you who may be aware, the 3 largest health insurance plans, their stock plummeted by more than 12%. And just on that one revelation and announcement. So in my view, artificial intelligence is now synonymous with innovation in healthcare. And at the end of the day, I just like this graphic. At the end of the day, I think, and that could be a real doctor using the telehealth device, or it could be a doctor that looks real. but is a virtual agent talking to you. And not just talking to you to provide a diagnosis, making an appointment for you. So you guys all heard about Google's little duplex chat that calls on your behalf to make the analogy, or the example they used was a hair appointment. If you guys haven't seen it, it's look it up. So there's AI agents on your phone calling out and making appointments for you. Why not an AI agent that does it all? Diagnoses you, considers whether it's an ER appointment or an ER trip that you have to make, finds the ER with the least wait time within your health plan because it knows your health insurance plan, or finds an urgent care, or finds an appointment at your specialist or whatever. I think that's coming. But again, the number one thing in all this technology talk about AI, even telehealth, is keeping a focus. A very important lesson I learned and relearned and was reinforced at my time at Martin Luther King Jr. Community Hospital, was that no matter how much technology, advanced technology, you deploy and implement, it is still a very much a people game. People being the nurses, the staff, the physicians, and the patients. The entire reason we are in healthcare for the most part, and we're in kind of like this isolated industry in the U.S. marketplace. It is one out of every 7 people in the U.S. works in healthcare. It's 1/5 of our GDP. It is in many ways this isolated behemoth of an industry that is extremely politicized, yet we all need it. We need access to it, and we need convenience from it. We need it to feel safe. We need it to feel private. But at the end of the day, it's all about the patient. It's about us, our family members, our individuals. So whatever tools that you invest in or are developing, if you're an entrepreneur here, or are a provider or a health plan person that's here, AI has to be figured out, and how you're going to implement it in your networks, in your systems, in your processes, and I feel that it will be a major disruption in healthcare in the next 2 to 3 years. That's it. Thank you very much, and I will open up for questions.